Now I will demonstrate the topical medication. So the first thing we always do is wash our hands. And then I'm going to identify and gather my supplies. So I need a bottle of sterile water, my medication, I have my monthly medication record, I have my new bandage, I have a stack of sterile gauze, and I have 3 sets of gloves. So the first thing we'll do is review our monthly medication record and perform our first medication check. So we look on our medication container and it has Joey Doe, and this is a triple antibiotic ointment, and we're going to clean the wound with water and apply a small amount of the ointment to the wound 3 times daily, and we're going to cover with a sterile gauze pad. So on our authorization form, we have Jane Doe signed that we can administer to Joey Doe the triple antibiotic ointment, applying a small amount to the wound for a wound infection. We'll do this at 2 p.m. So the route is topical. We need to watch for a rash, redness, and itching. Special instructions would be to use the bottle of water for cleaning the wound prior to applying the ointment and to cover with a gauze pad. Okay, and this medication is not outdated, so we check the expiration date, and then we're going to ask for an assistant to help us with our procedure because Joey might not hold still. So then we're going to move on to our second medication check. So we have our triple antibiotic ointment for Joey Doe. We're going to apply it topically to, we're going to clean his wound with water, apply a small amount of ointment to the wound 3 times daily, and cover with a sterile gauze pad. So we're going to apply the triple antibiotic ointment to Joey's wound at 2 p.m. And Jane Doe has authorized that we can apply the triple antibiotic ointment to Joey Doe, a small amount of the ointment to his wound infection at 2 p.m. So the topical route. So I'm going to gather my supplies and medications and take them to Joey and explain the procedure. So we want to position Joey so that we can change his bandage. We're going to put on our first set of gloves. So the first thing we'll do is remove Joey's old bandage, and we are going to note the thickness, color, smell of any old drainage. So we're going to throw that bandage away. We're going to discard this set of gloves. We're going to wash our hands. And we're going to apply a new set of gloves. And we are going to reposition Joey because he's probably kind of squirmy when we removed his old bandage. Okay, and I have my bottle of sterile water. Here. So now we're going to cleanse the wound. So we are going to apply the sterile water to a gauze pad and 1 swipe across the wound, and we're going to throw that pad away. And we're going to do this, I'm going to do it 2 more times, but you're going to do it until your wound bed is clean. So one last time, we're going to put the sterile water onto the gauze pad, swipe, and discard. I'm going to remove my dirty gloves, wash my hands, and then we're going to perform our third and final medication check. So we're going to compare our medication container. For Joey Doe, a triple antibiotic ointment, we're going to clean the wound with water, apply a small amount of the ointment to the wound 3 times daily, and cover with a sterile gauze pad. In the monthly medication record for Joey Doe, we're going to apply triple antibiotic ointment. We're going to apply a small amount to the wound at 2 p.m. And Joey's mom has authorized for us to administer a triple antibiotic ointment, apply a small amount to the wound for a wound infection at 2 p.m. So the route is topical. I'm going to put on my last pair of gloves. And we're going to help Joey reposition so that we can administer the triple antibiotic ointment. So I'm going to apply a small amount of the ointment to another clean gauze pad. And we are going to apply that to Joey's wound. We're going to discard that gauze pad. We're going to take our gloves off. We're going to wash our hands. Once our hands are clean, then we can replace the medication, the cap on the medication container and the cap on the sterile water. And we are going to document that we administered the medication at 2 p.m. on the monthly medication record. We're going to return the medication and any unused supplies back into our lockbox. And I'm going to clean the medication administration area, and we're going to watch Joey for any adverse effects